A blood pressure is a pressure of blood pushing against the wall of your artery, or simply is a measure of force that your heart uses to pump blood around your body. A blood pressure is measured using two numbers. The first number is called systolic blood pressure. It measures the pressure of your artery when your heart beats. The second number is called the diastolic blood pressure. It measures the pressure in your artery when your heart rests between beats. The normal blood pressure is less than 120 over 80 milliliters of mercury. A high blood pressure, usually known as hypertension, is a blood pressure above normal. Ideal blood pressure is divided into four general categories, which are: number 1, the normal blood pressure. The blood pressure is 120 over 80 milliliters of mercury or lower. Number 2 is elevated blood pressure. The top number ranges between 120 to 129 milliliters of mercury, and the bottom number is below or not above 80 milliliters of mercury. The third stage is the stage 1 hypertension. The top number ranges from 130 to 139 millimeters of mercury, and the bottom number is between 80 and 89 milliliters of mercury. The last one is stage 2 hypertension. The top number is 140 milliliters of mercury or higher, and the bottom number is 90 milliliters of mercury or higher. Blood pressure higher than 180 or over 120 milliliters of mercury is considered to be hypersensitive emergency or crisis. Seek emergency medical help for anyone with these blood pressure numbers. Untreated, high blood pressure increases the risk of heart attack, stroke, and other serious health problems. It's important to have your body pressure checked at least every 2 years, starting at age of 18. Some people need more frequent checks. Most people with high blood pressure has no symptoms, even if blood pressure reaches dangerous high level. You can have high blood pressure for years without any symptoms. A few people with high blood pressure may have headaches, shortness of breath, or nosebleeds. However, these symptoms aren't specific. They usually don't occur until high blood pressure has reached a severe or life-threatening stage. I would like to share some causes of high blood pressure so that you might have an idea of how you personally can control it. A blood pressure is determined by two things: the amount of blood the heart pumps and how hard it is for the blood to move around the arteries. The more blood the heart pumps, then the narrower the arteries, the higher the blood pressure. There are two types of high blood pressure. Number 1, the primary hypertension, also called essential hypertension. For most adults, there is no identifiable cause of high blood pressure. This type of high blood pressure tends to build up gradually over many years. Plaque build-up in the arteries, called atherosclerosis, increasing the risk of high blood pressure. The second one is the secondary hypertension. This type of high blood pressure is caused by the underlying condition. It tends to appear suddenly and causes high blood pressure than does primary hypertension. Conditions and medicine that can lead to secondary hypertension include adrenal gland tumors, blood vessel problem present in birth, also called congenital heart defects, cough and cold medicines such as pain relievers, birth control pills, and other prescription drugs, illegal drugs such as cocaine and amphetamines, kidney diseases, obstructive sleep apnea, and thyroid problems. The main reason for creating this video was to educate you on how to manage and lower your blood pressure. The first one is exercise regularly. It's no secret that regular physical activity helps to keep you in good health. Regular physical activity can lower high blood pressure by about 5 to 8 millimeters of mercury. It's important to keep exercising to keep blood pressure from rising again. As a general goal, aim for at least 30 minutes of moderate physical activity every day. Exercise can also help keep elevated blood pressure from turning into a high blood pressure. For those who have hypertension, regular physical activity can bring blood pressure down to a safer level. Some examples of aerobic exercise that can help lower high blood pressure include walking, jogging, cycling, swimming, or dancing. The second one, eat a healthy diet. Eating a diet rich in whole grain, fruits, vegetables, and low-fat dairy products and low in saturated fat and cholesterol can lower high blood pressure to up to 11 millimeters of mercury. Potassium in the diet can lessen the effect of salt on your blood pressure. The best source of potassium are food such as vegetables and fruits. And for fruits, if you want to know what type of fruit you can choose, just watch videos on fruit addition and you will be good to go. Ask your care provider how much potassium you should have. If you are still enjoying the video, I would be very glad if you subscribe and like the video. Consuming less salts. Salts cause your body to retain water, which put a strain in your kidney and your body vessel, and raising blood pressure. Potassium relaxes the wall of your body vessel to make it easier for blood to flow through, hence lowering the blood pressure. Number 3, lose weight and maintain a healthy weight. Extra body weight can increase your risk of hypertension because it causes many changes in your body. It can disrupt hormone that increases the risk of high blood pressure. It can also cause plaque buildup in your artery, forcing your heart to work harder. Being overweight or obese also increases the risk of obstructive sleep apnea, which is a common condition that contributes to a high blood pressure. People with extra weight around their midsection or the stomach are at increased risk of high blood pressure. Know that by exercising, you may reduce your weight, or even you can ask your healthcare provider some tips on how you can reduce your weight. Next is limit alcohol and caffeine each day. Drinking a lot of alcohol, more than 1 drink per day for women and 2 drinks per day for men, can raise blood pressure. And alcohol can interfere with blood pressure medication so that they don't work as intended. Drinks that are high in caffeine can also cause a spike in blood pressure for some people. Quit smoking or smokeless tobaccos. Smoking cigarettes or using smokeless tobaccos increases your risk of high blood pressure because nicotine causes your blood vessel to constrict or tighten. Narrow blood vessel mean your heart has to work harder to pump blood. Within 2 weeks of quitting, your circulation and lung function improves. Quitting smoking also improves your overall health and reduces your risk of heart disease. Get plenty of quality sleep. Quality sleep have many healthy benefits such as lowering your blood pressure. And lastly, take blood pressure medication as prescribed. If your doctor prescribed you a blood pressure medication, take it exactly as prescribed. Taking your medication at the right time each day can help you maintain a steady blood pressure and avoid spikes. That's all I have for you. I hope you have been educated and you have learned something. Please like and comment on the comment section. Don't forget to subscribe if you haven't so that you won't miss any video. Thank you for watching and stay healthy.